Hey guys, hope you all doing good. Hey, just kind of wanted to go over a few things. I'm just 5 days away from surgery. Um, so I don't know how much detail I went into in the prior videos about exactly what's going to take place. So I will arrive a day early for the surgery so that I can be there at 7 a.m. They're going to, so I will drive out there. It's about a 3.5 hour trip. So I'll stay in a hotel, and then the next morning I'll get up at 7 to be there. Um, they're gonna. It's a general anesthetic, so I'll be totally out. They're going to take out all my teeth, which is 16 teeth remaining. Um, they will then put as many implants as needed. Um, and right now, I believe they're going to put 4 on the bottom and 4 on the top. And then when I wake up, I will have a set of, they're like plastic teeth. They make them on a 3D printer. And so I'll wake up with those in my mouth. They say be there at 7. Surgery probably starts around 8, and I should be done around 12. Uh, and I guess when I first wake up, my tops will be in, my bottoms there will be making them at that time, and then they'll bring them in and they'll install them into the implants. Then they will send me back to the hotel. I will stay there that night. Talking with AI, just I do a lot of chat GDP. Talking with that, I don't want to say him, that, um, that I can expect at least real moderate pain that night because I'll still be kind of drowsy from the anesthesia plus the Novocaine and everything they'll put in my face. So it suggested that I sleep kind of an upright position to help with the pain level. Now, they say there's going to be a good amount of swelling, maybe even some bruising in the jaws and the skin out here, uh, and so it suggests, of course, ibuprofen. Of course, I have only one kidney, and ibuprofen kind of restricts blood flow to the kidney, and then the kidney is the one who um, handles ibuprofen. So I don't want ibuprofen. I haven't taken it in 6 years. And so it will be Tylenol. And there's a couple suggestions that AI gave me that is an anti-inflammatory that I can take. That's dissolved through the liver. So I will suggest that. Um, so I'll wake up the next morning with full teeth in my mouth. I will go back to the doctors so they can just check on the healing process, make sure there's no bleeding or anything like that. Then after they release me, then I will live with those plastic teeth for 4 months. Starting off in the very beginning stages on pudding and applesauce, soups. There's a limit of things I can eat. What they do not want you to do is bite. I can't bite like a hamburger. But during that time in the first 4 months, I will then be able to eat things like meatloaf, um, yay, uh, and maybe even beef or maybe pork that's been cooked in a crock pot all day, so it's really tender. Um, but after the 4 months, then they will take those plastic teeth out and give me a prototype teeth. Those are a little sturdier teeth that I can actually chew with, but they're not my permanent teeth. They want you to wear the prototype teeth for at least a month to make sure they fit good, that I'm not affecting my speech or anything. And if I like those prototype teeth after the first month, then they will make my permanent teeth. If I don't like them, we need to make adjustments to them, then I'll go to a second prototype. I have up to 3 prototypes to decide I like the teeth. After the third one, then they charge me $750 per prototype. But they said that, within the first 1 or 2 prototypes, everybody usually finds a great fit for their mouth. And so it takes Well, that's 4 months plus a month. At best shot, you're at 5 months. Plus, you're going to wait for your teeth to come in. So 6 months. They're made of zirconium, which is kind of the strongest of the bunch. Should last like 20 years, which I'm 60, so that puts me at 80. And at 80, who cares? I'll go to dentures if I have to. But the thing is, then every year I will go back and get the teeth removed. They will professionally clean them and put them back in. Every night you'll use a water pick, which they provide to me. It's a water pick because there is a space between the teeth and the gum line. It's fractional, but you'll take that water pick and shoot it between there to get anything that's in there out. And so that's kind of the stages of everything that's going to happen. Now, I went to kind of a pre-op thing the other day just to do some follow-up questions I had about what I could eat, what I expect, what the pain level is going to be, what they're going to give me. And so that was kind of informative. What else did I want to mention to you? Now, for the people out there still dealing with toothaches, and I've tried everything on a toothache, from ambasols to the gels. Even one time when I was 19 years old, you hear that cocaine deadens things, in your mouth. I even tried to put cocaine on a tooth one time. Do not do that. It angered it. And I'll never even attempt that again. But what I found out over the years of having, I don't know, 40 different occasions of teeth problem, is baby Orajel. Baby Orajel seemed to work the best. Ambisol just burns like hell. But no, baby Aerogel, that's the one thing I kept in my travel bag. I've always had a tube of it, because when you need it now. You don't need to go to the store and get it. They might be out, so always make sure you have a tube of that. And a heat rag, put it on the side of your face. That seems to help quite a bit, at least get you through the night. And anybody that has tooth problems, we all know it always happens on a Friday night, because then you can't get to the doctor until Monday. That's been my luck. And now, since dentists don't ever work Fridays, now it's Thursday night that it happens. Even longer time to get there. That I did find out real later in life that you can go to urgent cares. And at least urgent cares can start you on antibiotic right away, because that's all the dentist is going to do really for you anyway. If you ever notice an abscess in your gum line where the infection wants to get out, don't ever just pop those, because that's poison, and if you swallow it, then that can cause more of a problem. Now you accidentally do it anyway. Just try not to do it. But if it does happen, try to squeeze it all out and spit it out. Don't let it just stay in your mouth. Well, like I said, it's 5 days till surgery, and anxiety's building. I had some time again here at work, so I thought I would share some thoughts with you. I won't see you again probably until the night before surgery. From the hotel room, I'll try to talk to you guys a little more, just to see how bad my nerves are, and it's already got a lot on me. Anything that's surgical, and you're going to be in pain and it's voluntary, and you're going to be in pain, and I'm not looking forward to it. I'm looking forward to being able to smile and have a nice, pretty smile, but it is anxiety. But anyway, I'll hit you back in 4 days when I'm in the hotel room. We'll see you. Be careful.